Hi, this is Dr. Giuseppe Marinacci of BioHealth Holistic Dentistry. My previous dentist told me that I have to wait a few months between the tooth removal and the implant placement. Is that true? So what basically happens after a tooth removal? So the gap left from the extraction is filled with new bone, and this usually takes between 6 and 8 weeks. From that moment on, the bone starts shrinking, so the bone becomes shorter and thinner. What does it mean? It means that if you wait too long, in the long term, you would need a bone graft to make that bone left bigger in order to place an implant. If you're talking about a front area, an aesthetic area, okay, waiting months after the tooth removal can be very, very detrimental, because obviously the bone is going to shrink and the gum is going to follow the bone. So at the end, you could have a shorter bone with a shorter gum, which means at the end a longer tooth. So from an aesthetic point of view, it's not ideal, okay? So that's why at BioHealth Holistic Dentistry, we choose to place the implant straight away, immediately after the extraction, basically the same day, at the same session, when possible. In the majority of cases, it's possible. And this way, we can preserve the bone, we can preserve the gum recession, we can stabilize the surrounding tissues around the implants, because basically the body is going to read that signal as the tooth is still there. So there is no need for the body to basically reduce the bone, to reduce the gum, because let's say the tooth is still there. Okay, so basically our body works on a saving mode. Okay, when possible, the body tries to reduce the energy consumption. Okay, so basically a smaller tissue will consume less energy. Okay, and that's why we don't want that, because from an aesthetic point of view, but not only, it could be even a functional issue if we are talking about molars and premolars, where the forces of mastication are very high, and if you wait too long, the bone left will be definitely shorter and smaller. Okay, which means that we should choose a smaller implant as well. Okay, so that's why it's extremely important to understand that it's completely safe to place the implant immediately after the extraction, and there is no risk of leaving an infection behind. Why? Because obviously once the tooth is removed, we remove all the infection, we remove the periodontal ligament, we decontaminate the bone with ozone gas, and we double check with the autonomic response testing to make sure that that area is not stressed anymore, that is not testing for any germs, any toxins anymore, and then only then we place the implant. Obviously we use PRF, okay, to fill all the gaps around the implant and to seal everything. Okay, so in this way you can even save time. Okay, we can save months on the overall timing, because obviously you don't need to wait between the extraction and the implant, because once the implant is in, you have to wait anyway for the bone healing. Okay, so in this way we can even reduce the number of months needed to complete the final work.